Hello, everyone. My name is Michelle Putnam, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance. Today's call will focus on 10 truths about COVID-19. But first, at the top of the call, we will hear from Dr. Nancy Messonnier, Director of the National Center for Immunization and Respiratory Diseases and leader for CDC's COVID-19 Vaccine Task Force, who will provide us a brief update with the most up-to-date information about the COVID-19 vaccine. Next, we will hear from a CDC COVID-19 Emergency Response Medical Officer serving in support of the Chief Medical Officer, who will describe where we are with the response. Then we will hear from the CDC COVID-19 Emergency Response Chief Medical Officer, who will discuss 10 important truths about COVID-19 and provide the facts and the data behind each truth. I will note that if you experience any technical difficulties or would otherwise like to review today's call, you can find the recording on cdc.gov and on YouTube within about 8 to 10 days. All past partner calls can be found there, so please take time to review and share prior recordings. If this is your first webinar with us, welcome. These calls occur every Monday at 3 p.m. Eastern Time. Please see the link on the slide to subscribe and receive future call invitations. Please note this call is not intended for media, although we do welcome any media who may be here today. Should media have questions, we invite you to reach out to media@cdc.gov. Also, we will have 2 short polls, one now and another at the end of the presentations, to get feedback on the effectiveness of these calls. If you haven't already, please answer the poll that you see on your screen now as we get started, and then you'll see another one before we start the Q&A section. These calls are designed to share the latest science, guidance, and resources from CDC's website. There are over 2,000 documents providing information and guidance for individuals, businesses, and the public on cdc.gov. And now, as I said at the top of the call, I am so excited to announce that we have a late-breaking update and some information about the COVID-19 vaccine and some recent events that you have probably seen. Dr. Nancy Messonnier, who is the director of the National Center for Immunization and Respiratory Diseases, and also the leader of CDC's COVID-19 Vaccine Task Force, is here to provide the most updated information about the COVID-19 vaccine from CDC. Dr. Messonnier, thank you so much for joining us today, and I will turn it over to you.
Great, thank you. Thank you all for making a little bit of time at the beginning of this call to talk about COVID vaccine. It is obviously an unprecedented pandemic, and these are challenging times for all of us. A successful COVID-19 vaccine program is a light at the end of the tunnel, but it is a long tunnel, and we're all going to have to do a lot of work to get to it. We did have a historic weekend. Last Friday, the FDA issued an emergency use authorization for the Pfizer COVID-19 vaccine. On Saturday, CDC's Advisory Committee on Immunization Practice issued a recommendation for the use of the vaccine in those over 16 years of age. We published recommendations in the MMWR on Sunday, and between Sunday and today, you should be finding a series of clinical considerations and administration materials posted on CDC's COVID-19 website and our vaccine site. Today, the first doses of COVID vaccine were delivered to jurisdictions, and the first shots went into arms. That's less than a year after the vaccine was identified. I know I stopped for a moment to look at those pictures and enjoy the moment. I hope you all did too, because it is a testament to a huge community of people that made it happen. As many or most of you know, in the beginning, there will be limited supply of vaccine, and the highest priority in this first couple weeks is going to those healthcare workers that are on the front lines and long-term care facility residents that have certainly borne the burden, the brunt of deaths due to this disease. As we move forward, the next priority groups likely will include essential workers, adults with high-risk medical conditions, and older adults. As clinical trials go on, we expect there to be more vaccines. And in fact, we hope that next week at this time, we'll also be able to talk about the second vaccine. That's the Moderna mRNA vaccine that's scheduled for review by FDA this week. Based on the current available data from our partners in Operation Warp Speed, we do expect more broad quantities of vaccine to be available for the general public by second quarter of 2021. Vaccine safety is always the highest priority, and we start from a place of knowing that the safety monitoring systems in the US are the most robust around the globe, and that this vaccine has been carefully reviewed. But we also know that some people may experience short-term side effects after vaccination. Like all vaccines, these vaccines may be mild or moderate. Most of them go away within a few days. The pain, the side effects generally include pain at the injection site, tiredness, headache, muscle and joint pain, chills, and fever. And the data from the clinical trial suggest that some of those side effects may be worse on the second injection. It's going to be important to be transparent and clear in communicating about the side effects and ensuring the management of those side effects, especially for these folks that are getting vaccinated first. It's really critical to building vaccine confidence. As I said, our safety systems are ongoing. Existing systems have really been enhanced by new systems, and we're especially focused on our new text-based system called vSafe. People do need to opt in for it, but we're really hoping that you'll help us in getting out the word, because that early phase, getting really great data, is really going to be crucial as we roll these vaccines out. I guess I'll close by saying that this is a historic moment, but there will be unanticipated challenges. CDC will work closely with the partners and our jurisdictions to find solutions, overcome obstacles. Vaccines are an important tool to control the pandemic, but at least for now, we're all going to continue to need to wear masks, socially distance, and wash our hands. And communication and education are clearly critical to a successful vaccination program. Our goal has to be to get high vaccination coverage in every segment of our population, in every community of our country. What can you do? Please keep acquiring information. Lots of information will be going up in the next week on our CDC website, including toolkits for medical centers, clinics, and clinicians. Please share your knowledge. Help us to build confidence. We are really reliant on community-driven efforts. We can provide toolkits, we can provide materials and tools, but a lot of the hard work has to go on at the community level. We are all in this together, and we really appreciate you joining with CDC in these efforts. We are holding regular calls all week with many different groups, but we'll also have a partner call next week, I guess at this time, dedicated solely to COVID-19 vaccines. And again, I do appreciate your partnership at this historic moment. I got an email from somebody at CDC whose sister is a frontline healthcare worker and got vaccinated this morning, and sent a picture and remarked that, you know, she and her colleagues had tears in their eyes as they celebrated this moment. I know a lot of us here at CDC feel the same way, want to take a moment and appreciate the momentousness of the occasion, and then frankly, put our head down and get back to work. Thank you.
Thank you, Dr. Messonnier. That was a wonderful way to end it, and a critically important update. And I really appreciate you joining us. I know you're doing a lot of calls like these and amplifying these messages to so many partners. So thank you again. And you are right. We will see you again or hear from you again next Monday on this partner call, where we'll devote the entire hour to a vaccine update. So we look forward to having you back then. But again, thank you so much. I also am pleased to be joined today by two CDC experts on the COVID-19 response. Dr. Cliff McDonald is a medical officer serving in support of the Chief Medical Officer for the CDC COVID-19 response, and Dr. John T. Brooks is Chief Medical Officer for the CDC COVID-19 response. And now I will turn it over to Dr. McDonald for some updates.
Thank you, Michelle, and welcome to everyone joining us. My name is Dr. Cliff McDonald. And as mentioned, I am a medical officer serving in support of the Chief Medical Officer, whom you'll hear from shortly for the response. Today, I'd like to provide a brief update on the response. Next slide. First, a situational update on cases and deaths. You can see from the slide that cases and deaths are unfortunately increasing. Two important stats here are the weekly average number of cases in the US over the past 7 days, which is 11% greater than the previous week's average. This is a significant weekly increase in case counts. The weekly average number of deaths in the United States is over the last 7 days is also 11% greater than the previous week's average, also a significant increase in death counts. What does all this mean? Well, an 11% increase in the number of cases and deaths tells us, of course, that we need to do more to mitigate and slow the spread of COVID-19. It is also important to note that racial and ethnic minority groups, particularly Black or African American, Hispanic or Latino, and American Indian or Alaska Native people are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of health and quality of life outcomes and risks. We encourage you to visit CDC's data tracker for the latest stats and COVID View for a weekly summary of key indicators for the pandemic. Before we move to today's speaker, I would like to remind everyone that the flu season is here. With rare exceptions, the CDC recommends annual flu vaccination for everyone 6 months of age or older. I encourage everyone on the call to get your flu shot and to support flu vaccination efforts within your organizations. Now is a great time to get the flu vaccine. With that, it is now my pleasure to hand you over to my colleague, Dr. John Brooks.
Afternoon or good morning, everybody. Thank you, Dr. McDonald. My name is John Brooks, and as has been mentioned a few times, I'm the Chief Medical Officer for CDC's COVID-19 emergency response. And the title of my presentation today is The 10 Truths About COVID-19. But before we begin, I want to acknowledge that during this season, we're celebrating light in the time of darkness. These are indeed dark days. We are setting records, as you've just heard, in terms of new COVID-19 infections and in terms of deaths. The American healthcare system is under tremendous strain, and there is the real possibility that some people will not be able to get the life-saving care they need. And many of us who aren't directly afflicted by the virus are suffering the loss of loved ones or of friends, the loss of livelihoods, or the loss of a secure home. The burden of physical isolation at a time when we traditionally gather together. But there's also hope. We have learned how to stop this virus, how to prevent getting it, and how to prevent sharing it. We now know how to better care for people who are extremely ill, and the percentage of sick people who die has improved. And safe and effective vaccines are a reality. Today, December 14th, 2020, the first vaccine doses are being given to healthcare providers and to Americans at greatest risk. And hopefully by the middle of 2021, we'll be giving the vaccine to anyone else who wants it. These days will pass, and we will succeed. So many of us, myself very much included, look forward to soon seeing the end of this crazy year 2020 and sending it off to the history books. We have just got to hang in there a few more months, and I know it can be hard, especially during the holidays that are already stressful for many people, and even more so now in this time of COVID. We'll get through this, and we'll do it together. We may all have come to where we are today by different paths, but at this crossroads, we stand together. As we have stood together against the 1918 flu, polio, Ebola, Zika, and now even moving towards the real possibility of HIV elimination in America, we will prevail, the light will return, because that's who we are as Americans. Next slide. So let's talk about the 10 truths. And this presentation will be about 10 truths. It focuses on common myths and misconceptions and about COVID-19 and provides the facts and data behind each one. So next slide. Although this presentation is meant to convey critical information about COVID-19, the information conveyed is not exhaustive. For more truths about COVID-19, please visit our website. That's www.cdc.gov. The information in this presentation is current as of today, December the 14th. All right, let's go to truth number 1. And the first truth that we'd like to talk about is that you can prevent getting sick and you can prevent spreading COVID-19 by taking the following steps. Among others, you can help avoid the spread of all respiratory viruses, including COVID-19. Follow state and local guidelines. Take extra precautions if you're at higher risk of severe illness or death if you got COVID. Wash your hands frequently, ideally soap and water, but hand gel works fine too. Stay 6 feet away from others when you can. And wear face coverings indoors and in other public places, and especially when you can't keep 6 feet apart from other people. Try to not touch your eyes, nose, or mouth. Stay home when you're sick, except of course to get necessary medical care, and clean and disinfect surfaces frequently, especially those you touch often. Each of these small actions together make a big difference, and they've been shown to definitely decrease the spread of COVID-19. To support the importance of these actions, I want to mention a December 11th Morbidity and Mortality Weekly Report we put out. That was last Friday, if I'm not mistaken. This report considered 10 different public health mitigation strategies and the impact that they had on transmission of COVID-19 and related deaths. This report looked at these 10 mitigation strategies shown in the graphic here, and we'll post the link to that report in the chat. For today, though, I really just want to focus on one of these 10 right now, and that is maintaining physical distance or remaining 6 feet apart from others and limiting in-person contact. This can really lower the risk of COVID-19 infection because it reduces exposure to infectious respiratory droplets and aerosols. This action is important even when you are not symptomatic because, and you're going to hear this a couple of times today, transmission can occur from asymptomatically infected people, people who are infected but don't have any symptoms and may not know they're infected. While it's difficult to determine the specific impact of physical distancing on transmission, since it is often used, as it should be, in combination with other mitigation efforts, one study has estimated that physical distancing decreased the average number of daily contacts by as much as 74% and reduced the average number of people infected by one infectious person to under one. Now, all that said, it's important to remember that no single strategy can control the pandemic. Rather, multiple mitigation strategies used together at both the individual and community level are what can really break the chains of transmission and reduce COVID-19. All right, let's go to number 2. And our second truth is that you can feel healthy and you can still infect somebody with COVID-19. As cases rise across the country, it is important to remember that many of those who have COVID-19 may not be aware they're infectious. Next slide, thanks. People who are infected but don't show symptoms can and do spread the virus to others. These can be asymptomatic people who never get ill, or what we call pre-symptomatic people. These are people who feel well now and they're infected, and they can be infectious as they are ill, as they're becoming ill. So before they develop symptoms, they're transmitting the virus to others. People without symptoms can and do spread the virus. It's estimated that more than 50% of all transmissions come from infected people who have no symptoms of illness. The potential for people without symptoms to spread SARS-CoV-2 underscores the importance of applying prevention practices, those ones you're going to hear a lot about if you didn't know already: social distancing, hand hygiene, surface decontamination, and of course, wearing a mask, face mask or cloth covering, as well as the other prevention practices. By taking steps like these to protect yourself at all times, we can also help limit the transmission of COVID-19 when we or others might be infected, but we don't feel sick and we don't know that we may be spreading the virus. Thanks. I want to make very clear, building on what we just discussed, this third truth that we are highlighting today, and that is that masks work. Consistently wearing your mask is an effective way to keep both you and those around you safe and healthy. When an unknowingly sick person wears a mask, this blocks exhaled virus and thus reduces the emission of virus-carrying droplets into the environment. And wearing a mask is also good for you. Next slide. The consistent use of masks helps reduce COVID-19, especially by people who don't know they are infected and are infectious to others. Multi-layer cloth masks are an effective way to block the release of exhaled particles along with the germs these particles may carry. Multi-layer cloth masks block not just the large physical droplets that we see in our exhaled breath and you may sometimes see land on the eyeglasses of a friend, but they also block 50 to 70% of these exhaled very fine, very small droplets and particles, which are also sometimes referred to as aerosols. Recent research has shown that multi-layer cloth masks also reduce the wearer's exposure to infectious particles. Multi-layer cloth masks can help filter virus-carrying droplets out of the air that you breathe in. Right now, though, the performance of currently available masks to filter inhaled small droplets is not as good as their performance blocking exhaled small droplets. But through the combination of these effects, blocking and filtering, mask use can reduce community exposure to COVID. Masks are a great way to keep you and your community safe, and they are most effective when everyone uses them. Just know that where political or organizational leadership has put into place a directive, or sometimes called a mandate, for universal masking, diagnoses and deaths from COVID-19 have dropped. For example, a recent MMWR report looked at what happened after the governor of Kansas issued an executive order requiring masks or other face coverings in public spaces. After the order was issued, in the 24 counties that chose to implement the mandate, the rate of COVID-19 reversed from going up and began to decrease. However, in the counties without mask mandates, cases continued to increase. So just remember that when you wear a mask, you protect others as well as yourself. All right, let's move on to number 4. And that's one you've been hearing all day, but it bears some repeating, that the COVID-19 vaccines will be safe and effective. And I really want to thank Nancy Messonnier, Dr. Nancy Messonnier, for joining us and providing that very timely, informative, and helpful update earlier. Right now, COVID-19 vaccines are a hot topic across the country and the rest of the world. Many agencies, companies, and organizations, including CDC, are working together to create, approve, distribute safe and effective COVID-19 vaccines. In all of this, safety is the top priority. You know, the discovery and use of vaccines is one of the greatest success stories in public health. We've used vaccines to eradicate smallpox and have nearly eliminated wild polio virus, and we've greatly reduced the threat of other devastating and potentially life-threatening infections that some of us almost forgot about, like measles, diphtheria, and whooping cough, which are at all-time lows. So to ensure the continued success of vaccines in the US, it's crucial for us to make sure they're safe so that consumers are willing to take them. Safety, by the way, is a priority during all phases of vaccine development, as well as during their authorization and approval. And you should know that once vaccines are in use in the field, safety monitoring is established as part of the vaccine life cycle. COVID-19 vaccine safety monitoring is going to be a coordinated effort by multiple federal agencies, including CDC. And for the COVID-19 vaccine specifically, there are special systems being set up to monitor, and that these are supplementing the existing and robust US vaccine safety system. So I think we can say with some very assuredly right now that COVID-19 vaccines will be both safe and effective. And for more information on the COVID-19 vaccines, I encourage you to visit our website and to participate in next week's webinar on Monday, December 21st, when you'll have an opportunity to hear from Dr. Nancy Messonnier again, who'll provide an hour-long update. Okay, truth number 5, and that is that COVID-19 is more serious than the flu. Both COVID-19 and the flu are serious, contagious respiratory illnesses caused by viruses. But COVID-19 and the flu, and I should say, excuse me, I meant to say, and both COVID-19 and the flu were caused by viruses. But that's pretty much where many of the similarities end. Let me address some of the reasons we consider COVID-19 to be more serious than the flu. While I'll briefly discuss 3 differences in the course of COVID today, there is more information on the differences between flu and COVID available on the CDC website, and I think you'll be able to see the link for that in the chat. First, COVID-19 seems to spread more easily than flu and causes more serious illness in some people. COVID-19 can affect almost every part of the body, not just the lungs, but other organs like the heart, kidneys, nervous system, and gastrointestinal tract. And it can cause blood clots that in turn can cause injury to these organs and other organs, like clots in the lungs or stroke. Second, it can take longer for people with COVID-19 to show symptoms than it does for people with flu. Typically, a person develops flu symptoms anywhere from 1 to 4 days after infection, but with COVID, symptoms can appear as early as 2 days after infection, but it can take as long as 14 days for an infection to declare itself. And third, People with COVID can be contagious for longer than those with flu. Most people with flu are contagious for about 1 day before they show symptoms, and they remain contagious for about 7 days. But with COVID-19, the length of time someone can spread the virus is, although it's still under investigation, current evidence suggests it's possible for you to begin spreading the virus 2, maybe 3 days before you begin to experience signs or symptoms of illness, and that you could remain contagious for at least 10 days after you started to feel ill. Next slide. Changing topics a bit, our next truth considers the lifelong health problems that may result from COVID-19. You can survive COVID-19 and still be left with lifelong health problems. I think many people might think that COVID-19 is a relatively benign infection as long as you're not elderly. It is true that most people don't require hospitalization. And as I've discussed, there are people who in fact will be infected and overcome the infection with never being aware they had it, never developing any symptoms of illness. Unfortunately, though, we're learning that recovery from the acute phase of COVID-19 is not the end for some people. People who were very sick can have permanent damage to the heart, lungs, and kidneys and the other organs I described a moment ago. But we're also finding that even people with relatively mild illness can sometimes develop these problems, as well as a prolonged phase of other problems. Symptoms of these other prolonged phase problems, what we're calling post-acute COVID for the time being, include fatigue that can be so profound you have difficulty getting out of bed. There could be chronic muscle aches, joint aches, headaches. Some people just go on coughing for a couple of months very hard, getting over the cough, and experience prolonged shortness of breath. And they also can experience something that's been described as a brain fog. Post-acute COVID-19 can impact all ages of people, including the young, and also otherwise healthy people. It can take a long time for some people to start to feel better, and still, even after weeks and months, some people are not back to their previous state of health. So the point really is this, that COVID-19 is not like the flu or a head cold, or what we sometimes call the winter crud. This is a new and potentially deadly infection in humans that leaves some people who recover, including young and otherwise healthy people, with prolonged and profound problems. So even if acute COVID-19 affects a small fraction of all infected peoples, just think about that. Even if we're 1%, given the numbers we're seeing, that means that there could ultimately be tens of thousands of Americans left with a prolonged recovery phase as the pandemic comes to an end. But all of these problems can be avoided if you can just prevent getting infected. So give you and everyone you know, and everyone you love, the gift of health this season by following recommendations both to avoid getting infected and to avoid sharing infection in case you get it. With our next truth, we really want to highlight the importance of testing. Testing, and with specific attention to viral testing, that's the testing to diagnose if you have the infection now, is an important strategy to interrupt the silent transmission of COVID-19 from people who never develop symptoms or haven't developed them yet. And as I said earlier, we now know are the cause of over 50% of all new infections. Because of this, relying on symptoms alone to screen and identify infected individuals is inadequate. Testing is effective because it can identify infected individuals, including infected people who feel well and may not know they're infectious yet to others, so that they can isolate themselves and not spread the infection while they're recovering. It's also important as we head into the holidays to be aware that a test only tells you that you did not have COVID at the time of testing. And know also that the test is not 100% perfect. It is very accurate, but like any test, a small percentage of people who are infected might be missed, something we call a false negative test. Therefore, it's important to continue to follow all the prevention strategies, including use of face masks, physical distancing, and monitoring for symptoms of illness, even if you have a negative test. And know that just because you tested negative doesn't mean you can't still get infected. If you test positive for COVID, it's important that you know what protective steps to take to help prevent the spread of it while you're infectious. Some things you should do are these. Stay home, except to get medical care. Most people with COVID-19 have mild illness and will recover at home without major medical care. Monitor your symptoms and take care of yourself. Get rested, stay hydrated. Stay in touch with your doctor. Be sure to get care if you have trouble breathing, persistent pain or pressure in your chest, new confusion, inability to waken or stay awake, or if you develop bluish lips or facial color. And separate yourself from other people and stay away from people and pets in your home. Wear a mask even at home if you must be around other people or animals. For more information about steps you can take, please see the link that I believe will be appearing in the chat momentarily. For our eighth truth, we want to discuss the ways that in-person learning can be made safer. Given the many known and established benefits of in-person learning, reopening schools as safely and quickly as possible is a priority. Schools and local health officials should make decisions about reopening based on available data in their area, including levels of community transmission and their ability to implement appropriate mitigation measures in the schools. That said, in general, the risk of COVID-19 spread in schools is lowest when the students and teachers engage in virtual-only classes, activities, and events. However, schools must also consider students' risk and well-being when schools are not open, including negative impacts of closure on essential school services such as school lunch programs, special education, after-school programs, and mental health services. While risk increases when students and teachers return to in-person learning, this risk can be moderated when mitigation strategies such as cohorting, staggered scheduling, social distancing, and masks are put in place and consistently followed. CDC has developed a variety of tools and resources to help K-12 schools address the COVID-19 pandemic. And in the last few weeks, CDC has released several new tools to help schools as we move into the new year. And these include a K-12 school COVID mitigation toolkit, COVID-19 mitigation walkthrough for in-person learning, and the poster series, What Do I Do?, along with many other resources. These tools, among others available on our website, can help district administrators and other school personnel in making decisions that protect students, teachers, and staff from COVID-19 infection and slow the spread of the virus. I'll also just add that if this topic is of interest to you, I encourage you to watch last week's partner update on new school tools, that's a tongue twister, new school tools for Healthy New Year. And that link is also being put up in the chat now, I believe. Addressing a question we've received often from pregnant mothers, our ninth truth is that you can safely breastfeed your baby if you have COVID-19. Now, having said that, you, along with your family and healthcare providers, should decide whether and how to start or continue breastfeeding. Breast milk provides protection against many illnesses and is the best source of nutrition for babies. While we don't know for sure if mothers with COVID can transmit the virus to babies through the breast milk, current evidence suggests that breast milk isn't likely to spread the virus to babies. If you have COVID-19 and you want to breastfeed your baby, then talk to your healthcare provider so you can decide together whether and how to start or continue breastfeeding. And if you choose to breastfeed or express breast milk while you have COVID-19, CDC provides tips and guidance on how to do this safely. For example, be sure to wash your hands beforehand and wear a mask while breastfeeding. If you have COVID-19 and you're choosing to express breast milk, use a dedicated breast pump that's not shared and wear a mask during expression. Also, wash your hands with soap and water for at least 20 seconds before touching any pump or bottle parts and before expressing the breast milk. And though a little off topic, I'll also note here that, that if you have COVID-19, you should wear a mask when you're within 6 feet of your newborn, but you should not put a face shield or mask on the baby, as these can increase the risk of accidental suffocation or strangulation in children that small. Okay, 10th truth. And for our final truth today, I want to emphasize that CDC will stay committed to science and to protecting the public's health. CDC is the nation's public health agency, and it has been for more than 70 years. Throughout these decades, CDC has consistently shown its commitment to science and protecting the public health. CDC was at the forefront of the eradication of smallpox, which has been considered the biggest achievement in international public health. It's helped lead the fight against H1N1 in 2009, and as mentioned earlier, the fight against polio, HIV, Zika, and Ebola, time and time again, in response to every public health emergency. And as part of CDC's pledge to the American people, we have based all public health decisions on the highest quality scientific data that is derived openly and objectively, placing the benefits to society of the benefits to our institution and ourselves, and treating all persons with dignity, honesty, and respect. CDC and our state and federal partners have been at the center of the nation's response to the COVID crisis. And throughout this response, CDC has continued to remain committed to making decisions made on the best available science. Recommendations we make and their consequences also affect us, our families, and our friends too. We know that this has been a challenging environment, but I just want you to know that CDC remains committed to the American people, and that's all people, regardless of their background or their station in life. So remember these 10 truths, practice them in your day-to-day life, and I promise they will help keep you and your family and friends safe and anyone else you come in contact with.
Thank you, Dr. Brooks, for that wonderful presentation. And thank you to Dr. McDonald as well for joining us and giving us an update at the top of the call and sharing some important information with us. Next, we will move into our question and answer period. But before we get started answering your questions, just take a moment and answer a couple of our questions by taking the poll on the screen. I will note that we received many great questions in advance of this call, and we'll get to as many of those as we can in this next half hour. And of course, in particular and understandably, we did receive a lot of great questions about the COVID-19 vaccine, and Dr. Messonnier will be joining us again next Monday to devote the whole hour to vaccine update and vaccine questions. So we're saving a lot of those for that call next week, and in addition, requesting you all to send any additional related vaccine questions that you may have so we can address them next week as well. So for this question and answer session, we'll focus on some non-vaccine related, but still very important COVID-19 questions. A few of them that we have gotten in is around the quarantine guidance and the updated quarantine guidance that was put out last week. So I'll kick us off with a few questions about the quarantine guidance. So Dr. Brooks, I'll turn the first question over to you. First, is it true that CDC guidance for quarantine has changed from 14 days to 7? And I'll toss that one to you.
Okay, great. Well, listen, I'm glad you asked about this. There's some confusion out there, so this is going to give us a good chance to help people understand exactly what we're doing. First, you need to know that local public health authorities determine and establish the quarantine options for the jurisdiction in which you live. Quarantine is used to keep someone who is well, but who might have been exposed to COVID-19 away from others. And that way it helps prevent the spread of disease that can occur before a person knows whether or not they're sick with the virus. So they're in quarantine and we're watching to see if they may become ill. Since the start of the pandemic, CDC has recommended that people who've been exposed to someone with COVID quarantine for 14 days. And CDC still recommends quarantining for 14 days as the best way to maximally reduce the risk of spreading COVID-19. People who discontinue quarantine earlier than 14 days, even with testing and daily active symptom monitoring while in quarantine, will pose a small but not zero risk of spreading the infection to others. However, CDC has also recognized that reducing the length of quarantine may make it easier for people to quarantine by reducing the time they can't work, the time they're away from school, and all the other burdens that it places on individuals. The small amount of increased risk from a shorter quarantine period needs to be carefully weighed against the benefits of reduced hardship, especially economic hardship. A shorter quarantine period can also lessen the stress on the public health system, especially in a time like this when in certain parts of the country new infections are rapidly rising. So we reviewed a lot of new research and data and identified 2 acceptable alternative quarantine periods, and these were announced last week. A 10-day quarantine period and a 7-day quarantine period. So for people without symptoms, they can either end or discontinue quarantine on day 10 without testing, or on day 7, but only after receiving a negative test. And after someone discontinues this shorter quarantine, they still have to watch for symptoms all the way through 14 days after the exposure, and to know that if they develop any symptoms, to isolate themselves immediately from other people and contact their local public health authority or healthcare provider to get advice on how to go forward, and to continue all the mitigation strategies that we have mentioned: wearing a mask, staying 6 feet from others, washing your hands, avoiding crowds, and taking other steps to prevent the spread of COVID-19. So this is CDC guidance. Your local public health authority makes the final decision about how long quarantine should last based on local conditions and needs. So follow the recommendations of your public health department if you're asked to quarantine. I just want to also say that as we've been doing since the beginning, we'll continue to evaluate new information as it comes in and update recommendations as needed.
Thank you, Dr. Brooks. And the next question kind of builds on this. Can you explain or expound on why the CDC recommendation, we recommend a 10-day quarantine for people after they test positive, but a 14-day quarantine after an exposure?
Right. Okay. So, yeah. So when you test positive, we actually don't call that quarantine. When you test positive, we call that isolation. Which is technically different from quarantine. Isolation means that we're separating people who are known to be infected, and that's the big difference. Isolation is when we're helping someone who is known to have the infection, they were diagnosed with it or have a clinical presentation that is unquestionably COVID, and while they're recovering, try to ensure that they don't inadvertently spread the infection to others. Available data indicate that people with mild to moderate COVID-19 remain infectious for no longer than about 10 days after the symptoms start. So, and if you don't have symptoms, then it's from about 10 days since the first positive test. So for persons with COVID-19, isolation can generally be discontinued 10 days after symptom onset, also with resolution of fever for at least the last 24 hours, without the use of fever-reducing medication and improvement in other symptoms. If you develop symptoms, for persons who never develop symptoms, so these people we talked about earlier who were asymptomatically infected, they could discontinue quarantine 10 days after the date of their first positive test. Now, looking at the other hand, quarantine is intended for people who've been exposed, but we don't yet know if they're going to go on to really be infected. And quarantine helps these people from inadvertently spreading the virus. Because it can take up to 14 days to test positive, we recommend 14 days of quarantine as the best way to reduce that risk. But as I just explained in the answer to the previous question, we have options that a jurisdiction is welcome to use where you could reduce quarantine to 7 or 10 days. And that all depends on the health department's assessment of local circumstances and whether they and the community would benefit from shortening the length of time, and if they have the resources like the testing available to do it. Again, these are based on what we know now, and we'll continue to evaluate and update as needed.
Thank you, Dr. Brooks. That was actually very helpful clarification around isolation versus quarantine. So thank you for that. I have another quarantine question. Like I said, we had quite a few come to us around the quarantine guidance and recommendations. Why does a person need to quarantine for COVID-19, but not for the flu or any other illness?
Yeah, that's another one that seems unfair, I guess, doesn't it? This virus has been so unexpected in so many ways. So as we discussed earlier, COVID-19 is different from the flu and actually from pretty much every other respiratory infection with a few exceptions. So recall that a person with the flu, you can exhibit those symptoms up to 4 days after infection, but with COVID, it can take up to 14 days. And so people with the flu, and people with flu can be infectious for 1 day before, whereas those with COVID can be infectious for up to 2 to 3 days before they start to feel ill. So quarantine is, because it's intended to help people who've been exposed and might develop illness from spreading it, that longer incubation period and also that little bit longer front end time when you could spread before you have symptoms means that the amount of time you need to quarantine is just longer than it would be for flu. And in fact, many people, by the time they've had the flu and are recovered from it, they've already completed what would have been a quarantine, but in that case, really it would have been an isolation because they were infected.
Great, thank you for that, Dr. Brooks. And I have one final quarantine question for you before we move on to another.
Oh my goodness, okay, all right.
No, I promise we'll give you a break after this one.
Okay.
So this one says, can a PCR test be done on or after day 5 of quarantine if someone lives in a place where the local health departments allow quarantine to end on day 7 with a test?
Oh, I'm really glad you asked that question because that's an important clarification I think I overlooked. So we've said that you can end quarantine early on day 7, but if you have a negative test. So what does that mean? So we and many other groups around the world have been doing a lot of mathematical modeling to try and see what's the shortest we can make quarantine with the least amount of risk that when somebody who actually has the infection is released might go on to infect somebody. And we looked at also how early before the anticipated end of quarantine could you collect the test? Because recall, the PCR test that a lot of people are getting, it takes a day or two to get it back. So we wanted to kind of bake that into the recommendation to make it easier for people to follow that recommendation. So in the modeling, we said, okay, look, let's look at the circumstance where we're going to end quarantine after the completion of 7 days, and I collect that specimen within 48 hours before. So you can begin collecting this. So let's say your quarantine is anticipated to end at 11 a.m. on a Friday. You could begin collecting the specimen and even testing it by 11 a.m. on that Wednesday. So up to 48 hours before, or roughly around day 5. It doesn't mean you have to do it then, though. I mean, there are other tests that are being developed, and I'm sure there are going to be more of these that can give a faster result at the point of care. So you actually could do the test right as you're getting ready to discontinue quarantine. We've provided that window to try and accommodate some of the testing delays that are out there.
That is very helpful clarification, and thank you for emphasizing that, Dr. Brooks. And I will give you a break as promised, and we'll come back with some more questions for you later. But I will turn to Dr. McDonald and ask him a couple questions about another important topic, masks and face coverings. And the question asks, what does CDC recommend for the average person to wear? Just a mask, just a face shield, or both? What's most protective?
Well, CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth masks. Although face shields are useful for preventing splashes to the face or eyes of the wearer, they're not particularly effective used alone as a form of source control to contain infectious respiratory secretions of the wearer. So instead, CDC recommends choosing masks that have 2 or more layers of washable, breathable fabric, completely cover your nose and mouth, and fit snugly against the sides of your face and don't have gaps. It should also be noted that cloth masks are not personal protective equipment. Neither cloth masks nor face shields are appropriate substitutes for what we call PPE, or personal protective equipment, such as respirators like the N95 respirator, or medical face masks like surgical masks in workplaces where respirators or face masks are recommended or required to protect the wearer.
Thank you, Dr. McDonald. I have another question here for you that's a bit more specific about masks. It asks, should students with documented disabilities and special education settings be required to wear face masks or face shields?
Thanks for that question, Michelle. Wearing masks may be difficult for students with sensory, cognitive, or behavioral issues. In some situations, wearing a cloth mask may exacerbate a physical or mental health condition, lead to a medical emergency, or introduce new safety concerns. If students are unable to wear a mask properly or cannot tolerate a mask, they should not wear one, and adaptations or alternatives should be considered instead. For example, if cloth masks cannot be used, make sure to take other measures to reduce the risk of COVID-19 spread, including social distancing, frequent hand washing, and cleaning and disinfecting frequently touched surfaces.
Thank you, Dr. McDonald. That was some helpful information, I think, about masks. And we do have another interesting question for you, especially in the context of enclosed spaces like classrooms. Will running a portable HEPA air cleaner provide additional COVID-19 protections that could potentially be used in places like classrooms?
Well, we know that COVID-19 viral particles spread between people more readily indoors than outdoors. When outdoors, the concentration of viral particles rapidly reduces with the wind, even a very light wind, or just the increased space and ventilation that's always occurring outdoors. When indoors, ventilation mitigation strategies can help to offset the absence of natural wind and air currents and reduce the concentration of viral particles in the indoor air. The lower the concentration, the less likely some of those viral particles can be inhaled into your lungs or contact your eyes, nose, and mouth, or fall out of the air to accumulate on surfaces. Protective ventilation practices and interventions can reduce the airborne concentration. One ventilation intervention that may help reduce the concentration of virus particles in the air is a portable high efficiency particulate air or HEPA filtration system to help enhance air cleaning, especially in higher risk areas such as a nurse's office or areas frequently inhabited by persons with a higher likelihood of COVID-19 or at increased risk of getting COVID-19. Understand, though, that while a ventilation intervention like a HEPA filter can reduce the risk of exposure to COVID-19 and reduce the spread of disease, by no means will it eliminate the risk completely.
Thank you for that, Dr. McDonald. And now I'll turn it over to Dr. Brooks. We have a question for you that I think plenty of people have been wondering about, and myself included, actually. How do you convince, or how do you reach, hard to reach people or reluctant populations and communicate with them that it's good to abide by COVID-19 guidelines, either whether that's CDC recommendations or, of course, state and local guidance as well?
This is it's a very, very difficult problem that we struggle with all the time in public health and circumstances like this, because I completely recognize that for some people, this can feel like a lot of imposition, that, some faceless government bureaucrat is making declarations that are really getting in the way of them having their normal life. And so the first thing I just want to convey to people is that everything that we recommend, we live by too. And many of my colleagues and us have children, families, friends, elderly. We need to work. It's not something that we're not very sensitive to. That said, I also want to say there are some people who you're never going to reach, and that's just human nature, unfortunately. But there are other people, a lot of other people, that if you can just help them find a way to get through this, you can make it more tolerable. A couple of things that I found have been useful, at least in my relatively limited experience, have been to remind people that at least at this time right now, this day will probably turn out to be a very important turning day in the epidemic in this country. And that is going to start getting better. We got to hang in there a little bit longer. As Americans, we're a community of people from all different walks of life. What we share in common is that we're one community. And many of these things that we are asking people to do are for the community's benefit. We're often asked to make some individual sacrifices for the benefit of others, and in this case, for a limited amount of time. This is not a permanent change that's going to be in place forever, God willing, but I'm certain that this is going to get better. So if you can frame it that it's a limited time intervention, that also helps. And then lastly, sometimes it can be helpful to remind people of the context. Our parents and grandparents and great-grandparents have, during their lifetimes, made some very serious sacrifices, both in world wars as well as economic crises and other pandemics. And so we're in a situation like that now. And if they could get through it, I think we can get through it too.
Thank you, Dr. Brooks. That was incredibly helpful, and I agree with you. And I especially liked how you noted a limited time frame and just providing people some hope in exchange for giving them some guidance and recommendations. I like that. And I will go next to Dr. McDonald with a question specifically about testing. And this requester and asker wants to know, what are the different types of diagnostic tests that are out there, and are certain types more accurate than other types? For example, are rapid tests less accurate than tests that might take a couple of days for the results?
Well, currently there are several authorized antigen tests and nucleic acid amplification tests, or NATs, for diagnosis of COVID-19. Also, serologic tests are used to detect antibodies to SARS-CoV-2, the virus that causes COVID-19. However, these serologic tests are not authorized for use to diagnose a new infection, only past infection. So antigen tests detect the presence of a specific viral antigen consisting of the nucleocapsid protein of the virus. Its presence implies current infection. Most of these tests can be used at the point of care, and most of the currently authorized tests return results in about 15 minutes. CDC's interim guidance for antigen testing for SARS-CoV-2 provides more information about antigen tests. And so hopefully that link will be shared with you. NATs, or nucleic acid amplification tests, amplify and thereby detect the RNA of the virus, which also implies current infection or very current infection or just recently acquired infection. Most of these tests are not authorized for use at the point of care. However, some are. The turnaround times for these tests range from 15 minutes to greater than 2 days, depending on the test and other logistical issues. For example, transportation of the specimen to the testing center, the laboratory, how many tests are being done, supply issues, and whatnot. Both antigen tests and nucleic acid amplification tests have high specificity for SARS-CoV-2 virus. However, the sensitivity varies by test, but is generally high for the nucleic acid amplification tests and moderate for the antigen tests. CDC has published a summary of differences between the nucleic acid amplification tests and antigen tests in a summary table number 1 of CDC's interim guidance for antigen testing for SARS-CoV-2. Unlike antigen tests and nucleic acid amplification tests, serologic tests are not direct detection methods for SARS-CoV-2 virus. They're not viral tests. Instead, these tests detect antibodies to the SARS-CoV-2 virus, which implies prior infection, not current infection. CDC has published interim guidelines for COVID-19 antibody testing to explain the benefits and limitations of the serologic tests.
Thank you very much, Dr. McDonald. And I see we have a few minutes left, and I will go to our last question. And I'll turn to you, Dr. Brooks. You started us on a message of hope, and I'm hoping that you'll end us that way as well. A lot of one question has been on the minds of a lot during this holiday season when so many of us will be missing our families and friends. Do you ever think that things will be quote unquote normal again? And how long should we wait? And when can we give people handshakes and hugs again?
Well, okay, so I'm a born optimist, so take that with a grain of salt. But I think, I honestly believe we are going to all get through this. I really hope that sometime towards the middle of next year, we're going to be getting to a place where some of these things that we're doing to mitigate can begin to get wound back. We don't know when that exactly is going to happen. It depends on the vaccine and what happens in terms of new infections. But certainly as we get into the third and last quarter of the year, I'm pretty sure we'll be thinking around things that way. But I'd be hesitant to call it a new normal. We're going through an incredible experience, and I think we're going to be better for it in the end. I just want to point out some interesting things. There is a whole generation of school kids for whom going to school and wearing a face mask is now normal. And we've seen that where in the Southern Hemisphere this year, where they get the flu like 6 months ahead than we do up here in the Northern Hemisphere, there was very little flu last year, and it looks like some of these mitigation strategies may have been what did the trick. So I think a lot of people are going to be considering, what if we learned during this that we can use going forward to reduce the risk for spread of any infection, but in particular to be ready in case another bad one comes along like this. The other thing I just want to say is it is a tough holiday season. This is going to be a holiday where many of us are going to be with ourselves, but hopefully we can stay connected both emotionally as well as telephonically, or however you Zoom or Link or whatever it is you use, with other people. Don't stay alone. Reach out to other people. This year is a small sacrifice, but that's so we can all be here next year.
Thank you, Dr. Brooks. You did not disappoint. I found that very inspiring and hopeful. So thank you so much. And thank you to you, as well as Dr. McDonald, as well as Dr. Messonnier, for joining us today. And for everyone else on the call, this concludes our time together. Thank you again for joining our call today. Thank you for sending such wonderful questions in advance. They really do help drive these calls. A recording will be posted on CDC's COVID-19 webpage and on YouTube in a few days, and the subscription link to receive future updates and invitations is listed on the slide. So thank you again, and please join us, as we said, next Monday, December 21st, 3 p.m. Eastern for a COVID-19 response vaccine update with Dr. Messonnier. And until next time, be well. Thank you.